The chair would now like to recognize the president of the American Medical Association, Dr. David O. Barb, for the presentation of awards.
Thank you, Madam Speaker.
Dr. Barb.
The recipient of this year's Distinguished Service Award is Dr. Boris D. Lushniak, MD. The Distinguished Service Award honors an AMA member for meritorious service in the science and the art of medicine. Dr. Lushniak played an active role in government service for nearly 30 years, having served as Acting Surgeon General from July 2013 to December 2014. He also held the position of Deputy Surgeon General from 2010 to 2013, and again from 2014 to 2015, as well as Assistant Commissioner for Counterterrorism Policy for the U.S. Food and Drug Administration from 2004 to 2010. Boris has managed in his public health career to play roles at many critical moments affecting our nation and the globe. He participated in disaster responses in Bangladesh, St. Croix, Russia, and Kosovo. He was part of the CDC National Institute for Occupational Safety and Health team at Ground Zero and was part of the team investigating the anthrax attacks in Washington. He oversaw much of our federal government's planning for bioterrorism defense in the years following those attacks. And in 2015, insisted as Acting Surgeon General on being sent to Africa to command the only U.S. government hospital treating Ebola patients there. Dr. Lushniak, please join me at the lectern. Dr. Lushniak, I'm pleased to present to you the AMA's Distinguished Service Award.
Thank you so much. Madam Speaker, Mr. President, or Dr. President, 27 years I was proud to wear the uniform of the United States Public Health Service Commission Corps. I'm the son of immigrants to this country. Fall of 1949, two young people disembarked off a transatlantic voyage in New Orleans, picked cotton in Mississippi, and then settled in Chicago, and 10 years later raised me in the pursuit of education, realizing that the entryway for immigrants into this country was critical. I, as a son of immigrants, as a first-generation college student, put my nose to the grindstone, and things worked out. Ultimately, it led to service in our uniformed services as the United States Public Health Commission Corps officer, commissioned on July 4th, 1988 by none other than C. Everett Koop, and then 27 years later, going from a young lieutenant to a rear admiral upper half. That's been part of the pathway. I thank you all for this honor. I thank those who supported this nomination, in particular Dr. Resnick and the dermatology and preventive medicine physicians out there. And I leave with one key note, is our work in public health is far from over. Every single time we turn around, there are new challenges in front of us. As the former Acting Surgeon General of the United States, I released the 50th anniversary report on smoking and health. 460,000 Americans still die every year from smoking-related diseases. As a dermatologist, I released a call to action for skin cancer prevention. But on top of that, we have the opioid issues. We have gun violence as a public health issue. We have obesity and overweight. We have antimicrobial resistance. We have new and emerging threats all the time. But perhaps the biggest threat that I want to conclude on is the realization that science oftentimes is questioned. And I go back in time recently to the March of Scientists in Washington, and the final words out of my mouth is what? What do we want? Evidence-based science. When do we want it? After peer review. Thank you so much for this honor.
recipient of this year's Medal of Valor is Robert Smith, MD. Our AMA presents the Medal of Valor for courage under extraordinary circumstances in non-wartime situations. Dr. Smith was an instrumental figure during the civil rights movement in Mississippi, providing consistent health care to those with little or no access. A founder of the Medical Committee for Civil Rights and the Committee for Human Rights in the mid-1960s, Dr. Smith and other healthcare professionals aided and treated civil rights workers and many other Mississippians during the Freedom Summer of 1964. In dangerous, volatile times for our country and Mississippi, Dr. Smith placed himself repeatedly in harm's way and made it his mission to stand up for the healthcare rights of African Americans. He is a man of compassion, courage, and bravery who routinely put the health and well-being of others ahead of his own by providing medical care to the poor, uninsured, and underserved citizens of Mississippi. Dr. Smith, please join me at the lectern.
Protocol already been established. I remember, and many of you remember, Fannie Lou Hamer, who said, "I didn't come all of this for to say thank you and sit down." But I assure you this evening, I'm like what King George said to his 8th wife, "I won't keep you long." I thank Dr. Claude Brunson, who chairs the Mississippi delegation, and they are here to support me today. Would you please stand for a minute? It's been a long journey since 1960 to this AMA stage in Honolulu, and my manic phase is coming out today. I also want to thank Dr. Patricia Harris, who chaired the AMA Board of Trustees, for this great honor. I pay tribute to the memory of my dear friend Medgar Evers and Martin Luther King and countless others who fought beside us and fell along the way, the veterans of the civil rights movements, patients all over our beloved country. I honor my professors at college, Tougaloo and Howard, as they instilled in me a clear vision that all people should have the right to good health care. My family is here today, my son and nephew. Would you please stand? Claude and Alfred. I thank the National Medical Association, the counterpart of AMA, for which I became a member as a student, and the role in motivating me. I see many students here as a part of student AMA, and I want to give them a hand. The AMA was particularly inspiring during those days following Medgar's assassination. I wanted, as many others, to take a more active role in negotiating resolutions to the condition that barred me from entering the local AMA chapter. That's when I was barred from entering the AMA national meeting in Atlantic City. It was June 19, 1963. Dr. Holloman and Mike Lear and I presented to this stage. We was asking this very House of Delegates to take an unequivocal stand against discrimination of the black patient and physician. We was forced out that day. We was forced out of the House of Delegates and began picketing, and other people joined us, for we knew that you controlled American medicine. We gained national attention, and under that banner, the Medical Committee for Civil Rights and Human Rights was formed. Prior appeals to the AMA to admit the black physician fell on deaf ears, and finally in 1948, the AMA adopted a resolution officially proclaiming that the County Medical Society is the sole judge of whom it should admit to membership. Freedom Summer came to Mississippi in '64, following this confrontation in '63, and many health professionals from all over this country came. And from this, many great things has happened, including the birth of FQHCs that now estimate 30,000, bringing health care to 30,000 Americans, the least of these. I also want to remember Dr. Hill, a former president of this association from Mississippi, a friend of mine, a colleague, who issued an apology along with Dr. Nelson and later Dr. Ron Davis, who apologized to the NMA. I said all along, dating back to early 1960s, when health care improves for the disadvantaged and especially blacks, we will improve health care for all Americans. I'm proud to say that despite all the problems that we have in American medicine, that I have seen this marked improvement. Healthcare, as you know, has evolved from a small, privileged cottage industry to one of the 5th or 6th largest industries of this country. I say to you as physicians, we must continue through our individual practices and collectively through the AMA to play our role in advocating and guaranteeing health care for all. Monies for preventive medicine, education, research, and the social determinants of care. This award is particularly meaningful for me, for all those people and others that I have spoken of. I want to conclude by showing you a picture of my colleague that day as they joined me on the boardwalk. I was wearing a borrowed suit. Today, this suit belongs to me. Thank you so much.
Thank you. Great. This is great. Take that with you.
Thank you.
Thank you, Dr. Barb, and congratulations to our award winners. The chair would now like to recognize the chair of the AMA Board of Trustees, Dr. Gerald Harmon, for some additional awards.
Thank you, Madam Speaker. It is my pleasure this afternoon to recognize 2 medical executives who have rendered outstanding service to the profession, working tirelessly to address the needs of physicians and to promote good care for our patients. Our first Medical Executive Lifetime Achievement Award is presented to Karen L. Hackett. As CEO, Karen Hackett worked with the American Academy of Orthopedic Surgeons Board of Directors and Executive Management Team to oversee a staff of more than 200 employees. She oversaw the planning, construction, and opening of the new orthopedic headquarters and state-of-the-art orthopedic learning center, and helped lead the development of a number of quality initiatives, including clinical practice guidelines, appropriate use criteria, and performance measures. Ms. Hackett strategically enhanced both member and external communications with award-winning, nationally recognized public service campaigns that educated the public and the media about what orthopedic surgeons do and the value they bring to society. She helped to grow the membership to 38,000 and fostered unity among various orthopedic specialties and industry stakeholders. Editorial, I'll add, that is no small feat. Ms. Hackett, please join me at the lectern.
Good afternoon, members of the AMA Board of Trustees, delegates, colleagues, and friends. I am very honored to have been selected as a recipient of the Medical Executive Lifetime Achievement Award. As some of you know, I retired in April of this year as the CEO of the American Academy of Orthopedic Surgeons. And during a retirement celebration, I was very surprised when Dr. Will Schaefer, who's the AOS Medical Director, told me that I would be receiving this award. I want to thank Will, Graham Newsom, Kyle Shaw, all the staff, and the board of the Academy for helping to make this award a reality for me. It has truly been a privilege to be part of organized medicine during my time with the Academy. It is so impressive and heartwarming to see volunteer leaders like all of you donate so much time to the profession, all with the ultimate goal of improving the health of the public and your patients. During my time with the Academy, I saw orthopedic surgeons do amazing work that improved the quality of life of their patients. It was a true privilege to be part of that. I want to do a special thanks to Dr. Bill Maloney, who is the current president of the Academy, for being here today. I really appreciate that he made the trip to support me. I want to thank my husband, Bob Carlisle, who is also here today, for his support over the years. He endured many weekends with me working and endless nights of conference calls, so thanks, Bob. In closing, I wish the AMA, the Academy, and all of the medicine the best as you move forward in these difficult and unsettled times. I am confident that you will do what is best for medicine and, most importantly, for your patients. Thank you again for this wonderful honor, and I'm very proud and grateful.
Our second Medical Executive Lifetime Achievement Award is presented today to Christine Ignazak-Nadolny. Christine Ignazak-Nadolny has served as Executive Director of the Medical Society of Erie in New York State for the past 22 years. She's recognized for her leadership and her talent for bringing people together. Ms. Ignazak-Nadolny has developed strong relationships with local and state officials, helping advance legislative initiatives and responding to evolving regulatory challenges. By staying abreast of national and state developments that affect the practice of medicine, she ensured regulatory and legislative compliance of members and their office staff. Over the last 2 years, she has played an integral role in addressing the opioid crisis in Erie County, having helped develop, circulate, and then finalize acute pain management guidelines and advisories to help physicians in the area. Ms. Ignazak-Nadolny, please join me at the lectern.
Madam Secretary, thank you to everyone here this afternoon. After 75 combat missions, Navy jet pilot Charles Plum was shot down by a surface-to-air missile. Years after his release from a communist Vietnamese prison, he was approached by a man who identified him and remarked that he was glad that Plum had ejected safely and survived. With astonishment, Plum asked the man how he knew. The man's response was, "I packed your parachute." In preparation for my remarks this afternoon, I realized that as I began my career working with physicians, I was the recipient of a well-packed parachute. In the past 41 years, this parachute has been continuously upgraded with resources, collegiality, mentorship, and most importantly, friendship and trust. I have been encouraged to initiate new relationships which will advance the medical profession. The most successful has been our relationship with the Bar Association of Erie County, which has provided a platform for mutually beneficial educational programming, understanding of each profession, and collegiality. I am humbled that the AMA has chosen me to receive this award and thank them, but realize that the success I have achieved is because I stand on the shoulders of truly good physicians and their support staff in Western New York. Among those I need to publicly thank, who have been with me every step of the way, are past and current members of this House, including Jim Cosgriff, Dick Peer, Nancy Nielsen, Tom Medeski. I wish to thank my docs back in Buffalo, including my past president, Tim Gabriel, my current leadership represented by Rose Birkin and Willie Underwood, who are here this afternoon. I also want to express my thanks to the entire New York delegation and its staff, my medical and legal society colleagues, my staff, and my husband, Ron, and to those special friends who have continually supported and encouraged me. Thank you again for this award.